Let's continue our talk dealing with posture integration into your report of findings by discussing the quotes on the poster. I have given you a lot of information on the previous videos, depending on which form of posture evaluation you are or now will be adding. Digital picture, Posture Pro, X-ray, or a combination of any and all of these. We've talked about several of the quotes, but here's a quick rundown of the poster and the quotes. During the examination, you can recap your findings, either subluxation or symptom-based, discussing the various quotes, relating them to the patient's case, and demonstrating possible and correlating causes. Quote number 1. Aging and degenerative arthritic changes are not synonymous. This is great for patients who have been told their pain is from arthritis or because of age. This quote is straightforward. If you're a subluxation-based practice or treatment-oriented, it works perfectly. I personally remember a patient who reluctantly came into my practice 15 years ago. She had pain in her low back and hip, which her medical doctor told her was arthritis, and there was nothing she could do about it. She was told, well, you're getting older, and this is to be expected. You're just going to have to learn to live with it. About a week into her adjustments, the pain was gone. Arthritis? A bad diagnosis? Or in this case, was a subluxation causing disease? Honestly, I don't know, and frankly, I don't care. I was looking to correct subluxations. I did what I told her I would do. I adjusted and corrected her subluxations. Her body did the rest. Quote number 2, under the first icon, 90% of the stimulation and nutrition to the brain is generated by the movement of the spine. This is great. It's an MD who received a Nobel Prize for brain research. Grab your spine. Show the patient how the spine is supposed to move. Explaining the quote, let them know that because of the subluxation or pain and stiffness, or even a decreased range of motion, however you want to explain it, their brain is not receiving the stimulation and nutrition it needs to run their body. Chiropractic adjustments allow the body to make postural corrections, restoring motion, and feed the brain, thereby allowing innate to flow and run the body, improving function, performance, and health. Quote number 3. For every inch of anterior head syndrome, it can be increasing the weight of the head on the spine by an additional 10 pounds. You have their photograph, or better yet, a Posture Pro 7, which can show the offset in inches. Show them on their bodies and how and where this can be or will be causing stress, tension, and pain. And you'll also want to explain subluxations and how they cause anterior head syndrome and can be affecting their life, their health, and their potential. See, this quote works easily in a subluxation-based or symptom-based practice. Quote number 4. Anterior head syndrome leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. The Mayo Clinic, November 3rd, 2000. This to me is the Mayo Clinic saying that subluxations cause problems. I can tell them this. I explain subluxations and then I correct subluxations. If you're more treatment or pain oriented, great. The Mayo Clinic is telling your patients that anterior head syndrome causes pain, symptoms, and disease conditions. You can now tell them that chiropractic corrects the cause. Quote number 5. Loss of the cervical or neck curve stretches the spinal cord 5 to 7 centimeters and causes disease. Loss of curve on x-rays or anterior head syndrome or even a military neck in their photograph speaks volumes to this quote. Dr. Bragg, a neurosurgeon, performed surgery on patients with MS and tied a ribbon to the base of their skull and C7 to bring back the curve. It dramatically helped the MS patients. Again, a subluxation or symptom-based practice. It works for both. Quote number 6. Deviation of the body's center of gravity caused poor posture, which resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and shortened lifespan. Wow, this works great with the lateral headshot or Posture Pro 7, and they're leaning forward. Do they have anterior head syndrome? This quote is from a study done in nursing homes by 6 MDs who concluded their findings, and it was published in the Journal of the American Medical Association. My years in practice have taught me that I can find subluxations and make an adjustment. Using the techniques I have learned over the years, I know with certainty that I can correct anterior head syndrome, if not completely, at least dramatically. If you can find a subluxation and make an adjustment that reduces their chances of reoccurrence by evaluating them frequently, you'll change lives. It's worth looking into. Again, subluxation or symptom-based practices, this quote works great. Quote number 7. Like it or not, the daily effects of stress and trauma do add up. This quote brings it all home, and if they're not committed after this, you may as well hit them between the eyes verbally and ask them, well, here are the facts. Sooner or later, you're going to have to deal with this and its effects. When will you finally take action?